Mental health is probably the most underserved medical condition in this country. 1 in 5 Americans will have a mental health issue at some point. But there's not enough therapists to treat them all. Enter medical FaceTime.
It feels like you drank 1,000 cups of coffee and it took no dose on top of that.
But Karen Winberg's anxiety disorder was no laughing matter. It was disabling and impeding her career.
I had to do a lot of public speaking, a lot of presentations, and my anxiety was holding me back.
When Karen lost the psychiatrist who had been helping her, she turned to technology for help. It's called Arcadian telepsychiatry, and it fills a large and growing need for mental health services.
60% of psychiatrists are 55 years old and older, and aging out of careers and retiring.
Life is good, just checking in.
And how's work going?
Through Arcadian, Karen connected with Dr. Michelle Casoli-Reardon, a psychiatrist at the prestigious Massachusetts General Hospital, who says that face-to-face technology is perfectly suited to psychiatry.
As long as I am there with the patient, I'm looking at the patient, I can get everything I need in order to get a really good assessment of that patient.
Karen and Dr. Casoli-Reardon demonstrated how it works.
How are you doing with your anxiety? How's that going for you?
Here they're just a few yards apart, but they could be miles away from each other. Arcadian uses a secure, encrypted, and HIPAA-compliant system to ensure privacy. Other advantages include that the patient doesn't have to travel to an office, and sessions can be scheduled at times that might otherwise be unlikely for doctor or patient.
Saturday mornings, I would sit up in bed, and I could be in the comfort of my own home.
Now, telepsychiatry is covered by most health insurance, vastly improving access to mental health services. But antiquated state laws are getting in the way. In many states, doctor and patient have to be in the same state to be legal. Some of that is being remedied, but technology is still outpacing some of our laws. But this is going to really vastly improve access to things that obviously we need a lot of.
Can't think of any downside, can you?
Not really. I mean, it's just perfectly suited. They said if you're an orthopedic surgeon, you need to have the hands on the patient and really work with them that way. For this, they just need to be able to talk and look face to face.